Welcome back, everyone. We are in the next part of podcast. Now we have a doctor from the Faculty of Dentistry. Doctor, kindly please introduce yourself.
Okay, thank you, Ms. Tamarai. I am Associate Professor Dr. Manikandan Natarajan. I'm a specialist in the Dental Public Health Department, and I've been working here at AIMST University for over 16 years. Currently, I'm also holding the post of Deputy Dean at the Faculty of Dentistry.
That's very nice briefing, doctor. Okay, doctor, can you tell more about how long you will be in the AIMS University?
I've been here for more than 16 years.
16 years.
Yes,
Okay.
at the Faculty of Dentistry here.
What are the experience that you have? Any different kind of the experience
Experiences, if you see,
among the students?
yes, there are lots of because I've seen close to 15 batches graduated from here. So I've seen a variety of students, but I always become very proud when I see students enter as a very doubtful, unsure young students as year one, and suddenly when after 5 years they graduate out as a confident, compassionate, and a very skillful dentist. So that transformation I used to see year after year after year after year, and that is something a very rich experience, and I'm very proud of that. I'm also a part of their success.
Their success. It was very, very, very interesting to say that. Okay, shall we go for the question, doctor?
Yes, Miss.
Okay, we have a questions like dentistry has always having been like a prestigious career, but in recent year, the story has changed. So when with the fees among the highest in private educations and market many is already started with the dental graduates, parents are students are difficult questions. In pursuing the dentistry today, worth, cost, and effort. What's the difference for the cost or effort?
Okay, I really feel that dentistry is still has its value. It can retain its core value because it is not just like other professions. It is something that is unique, that is special because we are going to help the people to maintain a good oral health and retain their smiles, retain their confidence, and as well as to have a very good quality of life. So naturally, a professional training or a program like a dentistry could be a little bit expensive. But although I would like to emphasize at this point is that our AIMST University is the university which is giving a very quality but affordable education. So the investment in this education is definitely going to be worth it, and it can bear its fruit because not many public have some awareness about dentistry now. But as we progress in the future, I'm pretty sure when everybody is going to get educated, when everybody is going to get awareness, then naturally there's going to be demand for dentists. There's going to be more demand for the dentists. So I would doubtless I can say that the investment in the education is really going to be worthwhile.
In future, is it?
In future, yes.
Okay, how detailedly we can tell this?
Yes. See, if you see the number of people, say if you take the Malaysian population, the number of people getting regular quality dental care is generally less. But in future, as we go, more people will become aware of their dental health. More people will go seek dental treatment from dentists. So naturally, more number of dentists will be required to take care of the oral health of all this population. So that is why I would say the importance of dentists is going only to grow in the future rather than reducing.
That's really good. So, shall we go for the second question?
Yes, please.
We also hear from the parents who worry that even after paying high tuition fees, their children may still struggle to secure the patient positions. How real the concern Malaysia dental industry? What is your opinion on this?
In my opinion, Mr. Tamarai, if you see, as I told before also, the kind of thinking is not very correct actually. We have to be more optimistic. The dental industry and the dental education system is more optimistic that in future the country or the Malaysian population might need more dentists. As I told before, dental health is actually integrally linked to our general health. So a poor dental health can also affect the general health of of a person. So everybody in the future is going to get this knowledge, going to
Because
become aware.
sorry for the interrupt, doctor. Actually, as a public, we are say as a public lah. So for public, they had we only have dental. Their concept is only one dental, but dental have many parts. As I know, there has a children pediatric, right? Okay, the children's and oral surgery. There is so many things. How we going to bring the aware to the public on this? Because when as a look at the public, as I know, dental is just treat the broken teeth. Am I correct?
That is what I'm saying. See, as of now, very few people have the required awareness or knowledge about the oral health and the dental treatments. But it is the duty of the dental fraternity. Dental fraternity, what I mean is, not only the dentists alone, the private dentists, government dentists, the lecturers working in the university, okay, even the students, okay, and the people who manufacture products for dental related things like the toothpaste. All these people have to come together to create this awareness, which we do from our AIMST University. Very frequently does that. Okay, once in a year we conduct awareness programs. We also go for different screening camps like that. When everybody is involved, when the entire dental fraternity is involved, the awareness is going to expand. When the awareness is going to expand, more people will come looking for dentists, and that will only increase the value of the dental program.
Okay. Do you think more people know that we are having our own clinic here? Do you think the public is aware, or students from other side also they?
What I would say is there are few who are aware of it, and there are few who may not be aware of. That is the exact reason why we do sessions like this, podcast sessions, and also to make the general public, the potential students, and their parents to aware that we are having a full dental hospital attached to our AIMST University dental faculty, where we treat a variety of patients, a diverse of patients.
Yes.
So one of the questions I think you mentioned, like regarding the patient inflow, all these kind of things. So right from the student age, they can see lot of patients here. They can treat a lot of patients here in our
They are
dental hospital.
treating the real patient?
Yes, of course. That is a part of their hands-on training program. So right from year 2, towards the end of their year 2, after the preclinical, they start the students start to treat their own real patients.
Oh, that's great.
And that extends until year 5.
Year 5.
Until they complete. So they will be seeing a very different varieties and diverse types of patients, a very comprehensive type of treatment they will be doing, so which will prepare them for the real world.
Oh, that's very interesting part to get more know about real patients, right?
Yes.
So there's okay. Now we are going for the next question, doctor. Some even argue that dentistry is no longer like previous career because of oversupply. It means the dentistry is the oversupply. Do you believe the profession is the risk of losing of this value, or simply involving into the something new in the AI, right? So something.
Okay, in the current world of AI also, I believe dentistry cannot lose its value. As I told before, our oral health, our healthy mouth and teeth is very important for our general health also. Okay, so because of that reason, see, no robot can come and do a treatment for a patient. At least as of now, it's not going to happen in the next few decades. So naturally, we need skilled, competent, compassionate dentists to treat the patients. And in future, when there are more awareness, then naturally more patients, all these patients and people are going to need real dentists, and dentistry will not lose its value, definitely, because now we can see everybody is very much concerned about the smile, about how they look. You see, even I've seen so many patients who come, first thing they come and say is, doctor, I want to clean this teeth. Why you want to clean it? Because I can see something black.
Yes, correct.
First thing, that's
even they broken the first teeth out there, they will feel
right from a child until even the very old elderly patients also, they are all concerned about their their smile, their looks. So definitely dentistry is not going to lose its value. It's going to only increase in the value in the coming decades, because we are also having, see, with the advent of this AI and all these kind of things, it's going to be what do we say, we can provide very different types of treatments for the patient to make their smiles much better, actually.
Okay. So on this part, how we are giving the student confident on this? How they treat because when we are treating on the real patient, they have a more confident on that, because because it's outside patient, it's not the inside patient or something. So outside patient mean how they bring the confidence to treat the patient.
Because
How we train.
with Miss Tamarai, what you can see, or what everybody can, and all the viewers have to know actually, is that it is the design of our specialized unique curriculum. Okay. So our curriculum is designed in such a way that the students are exposed to a lot of real time patients, different types of treatments they will be doing, right from simple treatment to even complicated or advanced care. And different specialties, like you mentioned, we have children like pediatric dentistry, oral surgeries, orthodontics, and they also will be, learn to use digital radiology, modern equipments, and moreover, we also ensure that there is personalized supervision and mentoring for the students by our specialists, by our lecturers. These lecturers come from a diverse background. Okay, they are from Malaysia, they are from other different countries, also having degrees.
So there is any language barrier between them, because it's a different country? So
not really. We do not have any such language barriers, because all are very well educated. They are all experienced. They have vast knowledge. See, so we all can generally converse in
the
English
simple
or
language.
even Malaysian. We can converse each other. We can communicate each other. So that's not a barrier, I would say.
So as long as the doctors, how many experience the doctor we have?
Okay.
How long the period of experience the doctor having?
There are doctors who are experienced more than 30 years. There are doctors who are more than experienced more than 20 years, like me, of course. I'm already working for 15 years.
Yeah, just now you said about.
So we have a lot of doctors who are highly experienced. They have a lot of knowledge in their chosen field of speciality. So they can enrich the knowledge and experience to our students here. Okay. So they are from different backgrounds, as I told. They're from Malaysia, some from India, we are from Indonesia, and we have degrees. I'm also from a UK degree. So we know how to bring in all the experience for the benefit of our students, so that the students can grow in confidence. Okay, they can become independent dentists. What is our aim is the student have to be an independent, compassionate, competent dentist.
Competent dentistry. That's very impressive to hear. Okay, doctor. Next we go for the next question. Prof, now let's turn to the AIMST University. Parents and students often compare between the private universities before making their choice. What makes AIMST dental program unique compared to private university in Malaysia, especially when the parents worried about the investing the such an expensive field? Because this one is such an expensive field, is it?
Yes, as I mentioned before, yes, when we are going to give training for a highly skilled program, naturally it can be a little bit expensive. Why the expense? Because of all the modern state-of-the-art technologies and equipments that we use. See, in AIMST, you see, already AIMST is a very big, wonderful green campus, which is close to 200 acres, I believe. And in that, we have a faculty of dentistry which has all the state-of-the-art modern equipments, tools, materials, including digital radiology, and soon students also will be exposed to digital dentistry. Okay, so we also have a very good set of lecturers, specialists who's going to train them, going to mentor them personally on one-to-one basis. So considering all these things, definitely AIMST has an edge over other private universities. And as I mentioned before, we are providing all this quality education for a very affordable cost. And investing in the dental program is definitely going to be really worth it for the parents.
Really worth it for the parents. Okay. So when you come for the dentistry as advising of a digital technology, right? Like CAD, CA, and 3D imaging and simulation lab, what modern facility technology AIMST and dental students get used during their training? Is that they're really using the things for like a...
Yes, if you see our dental simulation laboratory is one of the state of the art simulation laboratory where we use dummy models. Yes, of course, that is where they practice before they treat on to real patients.
So which year they're starting to use that, doctor?
They will start using it right from year 2.
Year 2.
And it will progress. Year 2, year 3, year 4.
Year 1, they fully on the practical.
Year 4, they're more on the practical. They will start using the dummy models right from year 2 onwards. And once they clear the dummy models, only then they will be allowed to start treating on the real patients. Okay, so that's how it is. And also we have digital radiology, and soon, very soon, we're also going to bring other digital components of the dentistry. So they will be exposed to all these latest equipments and tools which is required for practicing modern dentistry, because if you see, we do not want our students to be left out. When they practice, when they complete their program, when they go out and start their practice independently or work in the real dental field, they have to have the knowledge and experience of working with all these modern digital tools. We do not want them to be left out.
That's great. Really interesting. And doctor, I have one question. It's like parents believe that if the student want to study in the dentistry after the 5 years, they go for the housemanship, everything. They want to open for the private clinic or anything. So how the differentiation between that? Because there's some student they're thinking, no, I want to open the own clinic. I can earn more.
So you're asking, I think, about Ms. Tamarai, the career options.
Yeah.
Things they can do.
Yes, as a parents,
this,
they definitely ask, right? I want to open, my son want to open the clinic so he can earn more.
It depends.
So what's the difference on that?
See, it depends. I would say it depends on the interest of the particular student after they complete. As you mentioned, some straight away go open their clinic after the internship. They can open their own clinic. It's perfectly okay. As long as
they're well confident on that to treat the patients?
They will be confident. That is how our program is designed. That's what I mentioned earlier. Our program designed in such a way, the students, when they graduate out, they will be able to practice independently, competently, compassionately. These are things that these are principles we try to instill in them, the values we try to instill in them. They have to be independently doing the treatment. They have to be competent and skillful. And also they have to be compassionate.
So is that our maybe our faculty is encouraging to open their own clinic, or they are asked to for the government sector? Which one is
as I told, we do not say you go do this or you go do that. Okay. We give them everything they want. We give them the knowledge. We give them the skill. So it is the individual's decision which is better for them. Okay. Some may think, okay, I want to open a clinic. We also teach entrepreneurship, dentistry as a business, so that can also instill the leadership qualities, team working skills. So some may feel that, okay, I want to open a clinic, fine. Some may think that, okay, I prefer doing in a government. It's easy. Okay, then you do in a government.
So doing in the government, what is the best thing they can learn from the government side?
Government has different types of...
because they have a basic salary, right?
Salaries, they will have their perks. And they will have their career growth. You see, they enter as a first-year dental officer in the government. I know many of our alumni who graduated from the batch 1 and batch 2, which is way back in 2010-11. They entered as first-year dental officers. Now they are sitting as high officers in the government, who are overseeing the particular district also. Okay, so they can have a career growth in the government. They also can complete their masters in any specialty and can become
specialty for the facials. So is that related for the oral surgery or something?
Yes, specialties like oral surgery, pediatric dentistry, for children, orthodontics, where orthodontics, braces.
Yes, correct.
So these are all different specialties, and they can continue work in the government as specialists. That means their salary or their allowance could be more. So these are opportunities when they do it in the government. Or they can do their own their post-graduation in private also, so that they can see the patients in their own private practice.
But there is most of competitive, right, when they open the private clinic, because every places we are seeing when on the road, on this side we can say one more dental clinic and overside is a dental clinic. How the market is there?
That clearly shows how much demand is.
Demands.
See, when somebody is opening something new, definitely they would have done a market survey. When they do market survey, they will naturally come to know what is the demand, what is the patient flow is going to be, okay, what the income is going to be. Sorry. So naturally, Based on that only they're going to open. If you see even our restaurants, eatery shops, springing up everywhere, but everything is full still.
Yes,
Why?
correct.
Because people cannot live without eating.
Yes, correct.
Same way, everybody requires treatment for their teeth, or at least to maintain their health, oral health. So definitely there's going to be a lot of patients where how many number of clinics going to come. Still there's going to be opportunities.
How about the international doctor? International students who want to continue the study in the AIMST.
International students coming to AIMST, you see, Mr. Tamarai, we are open to it. We welcome them. Okay, we are more than willing to take in our internal students. But if you want to ask about our students going internationally, okay, so some of our alumni have already gone to UK, to Australia and all, and they have settled there. So our program is also acceptable in international arena, where our students can pursue their masters in other countries.
They need to sit for any exam or entry exam for that?
Okay, if they wanted to practice in other country like Australia, New Zealand or UK and all, naturally they have to sit for licensing exam in that country. But to sit that licensing exam, our AIMST curriculum, our AIMST dental program is already qualified for it. Meaning you don't have to do anything separately. As long as they have AIMST degree, they can sit for the exam. But they have to prepare. Once they clear the exam, of course, they can register and they can practice in that country.
Practice in the other country.
But otherwise, if they want to only study masters in other country and come back, our AIMST degree is still qualified and acceptable there.
That's really great to hear, Doctor. And finally, Prof, for the student and parents still are undecided, right, about where to study. If you give one message directly to students about why AIMST should be their choice for dentistry, what will be?
All right. There's a lot of things actually I can tell that. But
maybe one of that.
To summarize, okay, I'll just summarize. Okay. Well, if I don't want to give one and leave the other point. So to summarize, if parents or potential students are looking for a dental program with academic excellence, a dental program which is having a strong clinical exposure, strong diversified clinical exposure, and they're looking for a dental program that is being taught and run by experienced lecturers with a vast enriched knowledge, and also a dental program where the campus life is going to be really vibrant, really enjoyable, and really memorable. And I think obviously, naturally, AIMST has to come to their mind first.
When we come for the investment type, like scholarships?
Scholarships, of course, there are a lot of scholarships.
Because most of parents are really worried on the causes, is it? So that's why.
I agree, because although AIMST is having the most affordable fee structure among all the private universities, still some parents might feel that is little bit out of their budget. So we have some scholarships and loan options also, like something like this MAD scholarships and loans is there, and we have Kwok Foundation scholarships and various other list of scholarships. And probably if the potential parents and the students can contact our admission division, and they can get the list and how to apply, they will be given all the details and information regarding this. Of course, we have a lot of scholarships available to help. Also, we also have PTPT and loans to help with the payments.
So next intake we can expect more students, is it?
Naturally, yes. We will be expecting a lot. Hopefully, the potential students and the parents, digest and synthesize whatever information they get through this podcast or through various other resources. And I believe and I hope that they choose AIMST dental program.
Thank you. Thank you so much, Doctor, for your opinions also what are the things we are having in our dentistry. And thank you so much, Prof. Dr. Manikandan, for your valuable insight. Today we have learned while the dentistry is the dilemma is a real high fees and competitive market. The key lies in preparation, explore, and choosing the right environment grow as a professional. For the parents and student, standing in the decision is never easy, but it's one you can shape their entire career. We hope today's decisions has given you the clarity and confidence as you consider the future. Until the next, thank you for the listening and stay inspired. Thank you so much.
Thank you very much, Ms.
Thank you.
Tamarai, for bringing me in here. This also provided me an opportunity to give my opinions about the field of dentistry and also give some information about the AIMST University. So I'm really glad to be here. Thank you very much for having me this time.
Well, thank you so much, Doctor, for your valuable time for spending us for the podcast section. Thank you so much.
Thank you.